Breast cancer is the most common cancer for women, and diagnosis is coming younger. Last month, the United States panel advised individuals start getting mammograms at the age of 40. That's 10 years earlier than previously recommended. Here in Canada, breast cancer screening isn't recommended until some women turn 50. Many experts say it is time for Canada to change that. Dr. Jean Seeley, head of imaging at the Ottawa Hospital, and Shira Farber, a breast cancer survivor, both join us this morning. Welcome to both of you.
Thank you.
Good morning.
Thanks for having me here.
Dr. Seeley, I'm going to start with you. A lot of people in their 40s are being told by their doctors they are too young to get screened for breast cancer screening. It's according to the guidelines. Why is that a concern for you?
Well, it's a big concern because we have evidence in Canada that impact is causing more cancers to be diagnosed at a later stage, more advanced stage, in women in their 40s. Because they're not benefiting from the opportunity of early detection with breast cancer screening with mammography. We have evidence with Statistics Canada that we did publish last year showing that in 55,000 women diagnosed with cancer between 40 and 60 years of age, there were significantly higher rates of more advanced stage breast cancers diagnosed in women in their 40s. And we saw a 10% increase in the rate of cancers that had already spread to the rest of the body that were metastatic since the change in the guidelines in Canada were done in 2011. So we're seeing women heavily impacted by these guidelines, and we want to save lives by starting to diagnose it earlier.
I remember as a client, as a patient, this being a concern when the guidelines changed. You might remember back in 2018, the task force advised against women aged 40 to 49 from having mammograms. This decision was controversial as it did not involve the input of radiologists. Dr. Seeley, what do you think were the motivations behind this recommendation? I remember being told it's because there were too many false positives.
Yeah, the guidelines were developed by people who are experts in methodology. So they didn't include patients, radiologists, oncologists, breast surgeons. And they really focused on the harms of screening, and they based them on old randomized controlled trials that really were done with very, very outdated technology, film screen that was not according to accreditation standards. So they didn't understand the improvements in technology or the fact that there are differences in the women being screened. They focused on the false positives, which are really abnormal recalls from an abnormal mammogram. And they also overemphasized the impact of overdetection. In fact, overdetection or overdiagnosis is a much bigger problem in older women. Mm-hmm. Younger women who are diagnosed with breast cancer are much more likely to die from their breast cancer if not treated or caught early. So they did not understand the impact of what we know as experts are the consequences of screening. And I think that that's the biggest limitation of those guidelines.
Yeah, Shira, I want to bring you into this conversation. As a survivor who was diagnosed in your 40s, you did want to get screened earlier. Mm-hmm. You were told that that wasn't possible because mm-hmm. it didn't go according to the guidelines. Mm-hmm. What's your response to this claim?
So, for me, breast cancer really wasn't on my radar. Like, I was under the impression that you needed to have a family history, which I did not have, to be, considered at risk. And so for me, I was really blindsided, as I think a lot of women are when they find out they have an advanced stage breast cancer. There's a big difference between a cancer that's been early detected and a more aggressive stage cancer, which is what I have and what a lot of women my age have. So for me, these guidelines are, I feel like there's a big disconnect between what the task force is recommending and between what's actually happening in doctors' offices. Mm. If you talk to women my age, you will discover the majority of them have had these conversations with their family doctor, and they are often talked out of having it. And the reason being that there's a risk of harm, the risk of harm being anxiety, which we know is transitional. Right? So if women maybe were told that there was a possibility that they might be called back mm-hmm. to have a better look, and if they were better informed about the process, there would be less, quote, anxiety.
That's right.
Had somebody asked me, would you rather have mammograms every year and maybe feel a little bit anxious because you might have a recall versus facing an advanced stage breast cancer, I obviously would have opted for number one, and I think most women would.
Shira and Dr. Seeley, that is all the time we have for this conversation today, but it is an important one. I want to thank you for highlighting it to us. Both of you today will continue to follow. Thanks so much.
Thank you.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.